Hello and welcome back to today's session. We are diving into one of the most fundamental processes in human body, inflammation from pathology. We often think of inflammation as a purely negative term, painful, hot, swollen, but in reality, it's your body's most critical, organized, and life saving defense mechanism. To make these complex concepts accessible, we are going to use an analogy throughout this presentation. So, imagine your body is a major metropolitan city. When damage occurs, the response is handled by a specialized force. That's the emergency response and construction crew. This crew is inflammation, and today we are going to follow their mission. So, it's a protective response designed to eliminate the initial cause of cell injury, clear necrotic tissue, and initiate the repair mechanism. Its goal is to restore the structure and function after the repair. So, yeah, the core job of our emergency crew is simple but vital. It's a protective response is designed to achieve three things: eliminate initial cause of injury, clear out all the dead or damaged tissue, and start the repair process. Look at the table on the slide summarizing two main types of inflammation. Acute inflammation. So, this is over here, it's a rapid response team. It's immediate, intense, and short lived, minutes to days. Think of fire trucks and hazmat crews arriving on scene fast. The primary worker here is the neutrophil. And here we have our chronic inflammation. This is the long term construction project. It's slow, persistent, and involves different, tougher workers. This happens when the quick fix fails and the crew has to settle in for months or years to rebuild or contain a structurally damaged area. So here we see delayed onset, persistent, and it involves lymphocytes, plasma cells, and macrophages. We have another type that's subacute. So it's intermediate phase. It's between acute and chronic, often used to describe the transition. And so the causes, what triggered the alarm? So the causes of inflammation are simply the different types of problems in the city crew that it's going to respond to. It could be an infectious agent, rogue bacteria, or viruses. That's our criminal element. It could be physical agents, as in trauma or burns. That's kinda a traffic agent. Or interestingly, it could be the city's own security system going haywire, immunologic reactions where the body attacks its own healthy tissue. Now, when the emergency crew sets up, they put up clear, visible indicators, the cardinal signs of inflammation. So, these were first described almost 2000 years ago. Rubor and calor, that's redness and heat. That's the flashing red lights and hot pavement from all the activity. It's caused by blood flow being rapidly diverted to the area. Then we could see tumor. That's swelling. These are the giant barricades and equipment. Swelling is just fluid leakage from the blood vessels into the tissue. Then we could see dolor. It's pain. The detour signs, the chemical signals irritating your nerves. Then we see functioliasa. Oh, that's a fancy term. Loss of function. The street is simply closed to normal traffic. And then we see about the acute response mechanism, the initial response. Let's zoom into the acute response, the fastest part of operation. This phase is dominated by two stimulation events. First, the vascular changes. To get the crew and supplies to the scene, we must open the city's water pipes. That's our blood vessels. So this is vasodilation. The pipes then become intentionally leaky. That's increased permeability, causing plasma proteins and fluid to spill out. This is that exudate, which causes the swelling. That is rubor, calor, and tumor. Then we have our cellular events. The specialized workers, the leukocytes, white blood cells, moves from the pipe to the street. They roll and stick to the walls that is adhesion, they squeeze out through the gaps, diaperesis. Finally, they follow a chemical breadcrumb trail, that's chemotaxis, right to the center of the problem to begin phagocytosis. That's the cleanup crew literally eating the debris and microbes. Communication and coordination, the communication network, walkie talkies, and dispatch. So, none of this is random. It's perfectly orchestrated by our chemical mediators, the walkie talkies, and dispatch signals coordinating the crew. A key early signal is histamine, which is the first distress signal that triggers the pipe leakiness. Prostaglandins are crucial. They regulate the leakiness but also sensitize the nerve endings, which is why they are key drivers of dolor and fever response. The complement system is like a specialized biochemical assassination squad, proteins that circulate in the blood ready to kill the invaders, and cytokines like IL-1 act as systemic alarm signaling the entire body that there is a major problem, leading to our next topic, long-term and systemic effects. So here, if the acute team cannot fix the problem, the body enters a chronic inflammation state. The workers change. Go the swift neutrophils, and come in the macrophages, the powerful cleanup bosses, and lymphocytes, the intelligence and security team. If the invader is highly tough, the body uses a desperate measure. Granulomatous inflammation. If they cannot kill it, they wall it off. Macrophages tightly surround the threat, forming a highly organized bunker called a granuloma. Finally, when the crisis is big enough, the city issues a systemic alarm. Fever, the city's thermostat, is turned up to make the environment hostile. Leukocytosis. So the central factory starts mass producing more workers. Acute phase response. Factories pump out proteins like CRP to help contain the issue. And then the end goal is always repair. After the threat is eliminated, macrophages take on their final role, the final cleanup crew. They signal the end of emergency and the body initiates repair. The best case scenario is resolution. The tissue is restored to its perfect original function. The street is open, good as new. However, if the damage was too extensive, the body cannot perfectly restore the original tissue. Instead, it uses a simpler, less functional patch job called as fibrosis or scar formation. This is essential to maintain structural integrity, but the new tissue would not function quite like the old. So, next time you feel that heat or see that redness, remember that while it's uncomfortable, you're witnessing your body's incredibly organized, life saving emergency repair crew in action. Thank you. Keep reading and keep revising.